Thank you. First of all, I would like to thank the scientific committee and the steering committee of the CEDO and also of IDOR. I'm very excited and quite emotional as well. You might imagine that being the first speaker after such a long time is not easy. Seeing you in person after having seen you on a screen for such a long time is really very emotional. And thanks to all of you who have been brave enough to be here in person, to take a plane to come here, because this is a sign of recovery. And I hope this is going to happen more and more in the near future. I'm sure you can understand what I mean. Expand your mind. That's the title of my presentation. And the first thing you can see is that something happened at the University La Statale of Milan. And this thing gives me an opportunity to also thank the people that were with me in the past. I was in a university full of technology and the future, La Statale University. These are all very typical things of Italian universities, but this doesn't mean that I don't want to also acknowledge the people that helped me to get there, especially Professor Nidoli, SIDO's past president, Professor Macchi, and my younger brother, so to say, Professor Luca Livrini. But first of all, I would like to thank the people that made the Insubria University a reference point for many graduates of the past that are now very good professionals. You know most of them, but I would like to thank all my team groups that worked with me for 16 years. And I would also like to thank the way in which I was received, because being received in the headquarters of Professor Gianni is quite emotional, and I was indeed very emotional the first day that I went there as a professor. And so once again, thank you to all the staff that I found there. They were great. They made me feel at home. We will develop many programs in the future, but I would like to thank them from now. It's high time that we expand our minds. Let's start from this term, time, the time that was interrupted in the past 18 months. And when we talk about time, we talk about a number of events, and in my case, since I'm an orthodontist, we have to talk about orthodontic events. And in my timeline, these are divided into 5 decades. This is the 5th decade in my lifetime that I'm into orthodontics. In the past, I was a student in the Italian army. In the 2nd decade, I was a young researcher and a specialist. In the 3rd one, I was an associate professor. And then in the 4th decade, I was a director of ITEB. And what am I going to do in this decade now? I don't know, there's a question mark there, but I expect very beautiful things to happen. And so basically, this is the summary of my presentation, a short introduction, a tribute to the past, and in the 2nd decade, I will talk about what I have learned from the past. And when I say I mean the Italian school, because Italy is really state of the art in this sector. The 3rd decade was the tiles decade. The 4th one is the 3D decade, and the 5th one is what I call outside the wire. And so it means when you explore new territories. It's a technical term used in the United States. In the Italian army, they always said, "I'm outside the wire," which means that they were in an unknown territory. And then, of course, there will be conclusions. So we're gonna have past, present, and future. Let's get to the introduction. We've already been blessed by the Holy Father, but now I'm going to get in more scientific details. I like to remind the work of Professor Faronato, because when he had the opportunity to analyze the Turin shroud. There were many important things. A male, 123, 183 centimeters, AB positive as blood group. In his visual analysis, a posterior, there was a possible skeletal asymmetry. It has been also assumed since the events in the past few hours that he had a fracture of the condyle, and also another alternative was that he had a crossbite. Since trying to remain as aseptical as possible in the analysis, the transversal dimension was probably something that had illustrious patients. Well, the first decade is the past, of course. I'm not a Horus student. I was in the competition because I spent some time in Copenhagen, but I have to recognize that Professor Messen did a great work and indicated a special period of our life as favorable. But I'm also grateful to Jean Dallaire, who says that the natural expansion happens in mixed dentition, so that is the favorable moment where you should push a car, so to say. I'm also grateful to all the American school, from Biedermann to Ricketts, with a great debate, rapid or slow expansion,
fino ad arrivare
up to Andrew Haas and Professor McNamara, who made a technical breakthrough because he started talking about syndrome. Let's get to the second decade, which was made up of great friends. Letizia on the screen, looking over me while I was organizing conferences, Lorenzo, Marco, Tiziano, Mauro, who helped me understand a number of things. And we also started to treat patients, crossbite patients, to start changing support points on deciduous dentition and to wait for the growth. This is a patient for which we can discuss whether to correct this incisor. Technically, we can leave it as it is. But what we were creating was a tripod occlusion, which is at the basis of all the systems in which we sit, because three legs are the basis to be seated. And here's Copenhagen now with Professor Bjork, who said that we need an anterior rotation core in order to have a posterior development of the mandible, and only afterwards we need a rotation core in order to have a more balanced rotation. And it is even clearer when we see the works of Professor Pertomaki from Helsinki, who says that this type of rotation is fundamental, because otherwise we have a reduction of the growth hormones. And we basically work with growing children, so without hormones they don't grow, of course. So why wait? Basically, there's no reason to wait. And here we have the works of my students, who are now established professionals. Dr. Manti explained that during the expansion phase we also have a variation from an incorrect growth to a recovery of a normal development torque of the roots. As a consequence, we have expansion movements, reordination of the anterior sector, and correction of the torque of molars, which are free to do it. But this is also hypothesized by the American school, which says, take a ruler, put it on the palatal cusps of the sixths, see if there is a distance with the vestibular maxillary cusps of more than 1 millimeter, which is a normal situation, but about 3 millimeters, it means that there is a compensation which is not positive. And this is the reason why I start preparing my arches by adding to expanders some elastic chains if they're between the range of 1 and 3 millimeters. Otherwise, I need palatal bars for a correct expansion, and then get to a conventional expansion. And this is not systematically done, but in order to push something, at first I need to guide it towards the right direction. Then we're gonna have the RPEs, the attachments, etc. All of this also helps the periodontum, because the Messina and Catania schools together tell us that with conventional RPEs we lose thickness, and the Varese school with Dr. De Gregori says that the RME on E is more respectful as for the periodontal expansion. If we consider the effects at the level of sixth and E's, both on the mesial root and the distal root, we see that in relation to what happens to the root of the sixth, if we expand on the E's, we don't have any significant variations in this group, but we have some problems. In other words, it's much better to expand by unblocking, leaving unblocked the sixths. We also happy about what happened in the past, and we don't have any significant changes. We have forces delivered on deciduous teeth, and we also have a more orthopedic effect, but the less orthodontic effect. At this point, we only have to think about the posterior effects, but as for the anterior effects, we know that we also work with patients who are in the so-called ugly duckling phase. And so we have patients for whom we expand, so we reorder, and then we have the incisors group. We also have an effect on the growth direction. Sometimes there is some confusion about its definition, because we use RMEs to facilitate the descent of growth of canines, in order not to need debriding the canines. This is not what I would call it, because we can't promise something like that to all our patients' parents, but we can do something different. And this is why I asked 7 questions to one of my students. How much are we going to modify the alpha angle? If positive, how much? And also, is divergency significant? Is skeletal class significant? Is the appliance design significant? And is the gender significant? And we collected a good number of RMEs, and 7 responses were given to these 7 questions, which are summarized in this. We can modify it by 5 degrees, but if we start from 45, we don't solve the canine problem, we just reduce by 5 degrees. Of course, if we start from 22, we get down to 17, and that's a good help, but promising that we can debride the canine with an RME is science fiction. But of course, females react more, let's face it, this is true for all things. Something more that I like to work on is taking the cue from Nazan Kukukles, a professor from Marmara. We see that she says that there are variations on lip pressure at the level of the superior upper incisors group, and also the Pisa University made some works, and so that there was a modification of the anterior group that could be summarized in this terrible slide. This is a picture taken 7 days after the beginning of an expansion. we had a mesodense, and we decided to remove it 7 days after the expansion. Of course, usually you remove the mesodense and then you do the expansion, but this isn't written anywhere. Can you tell surgeons, can you remove a mesodense with an expansion in the mouth? The surgeons will definitely answer yes. They always say they can do something. And so we made some suture samples. We took some suture samples. But what is important is the alveolar fracture created during the expansion, which is submerged. They usually don't see them, but they produce a remodeling of all the fiber system. And we know that these fibers are built over time during eruption. So if I have a patient with incisors in this position, of course we know very well if there is one thing that our patients, parents care about is the disalignment of the front incisors. So let's put expanders from the very beginning. Let's break this system. Let's create these hidden fractures because the parents will never know about it. And so let's reorder. Let's allow for a restructuring of the fibers, and let's wait for a growth, and let's see what is the situation in the future. We know very well that the management of transeptal fibers is very important for relapses. And then let's get to transversal dimension, which tell us a lot of things. We have a mandibular repositioning in class 3. We have our RMEs and autocorrection and a repositioning. This is all but a class 3 at the end. As for class 2s, I'm quite embarrassed. This was a matter of discussion with Tiziano and Lorenzo for many times. With their angle at 125 degrees, with the division in good responder and bad responder. These expansion mechanics and detachment of the lower lip in order to facilitate advancement didn't convince me in any case. And this was one of the points for which I discussed with Lorenzo, because I think that the theory of the foot in the shoes is not so automatic. I mean, I think that we need something more, a second discriminant analysis, because all these angles have 125 degrees, but they have different shapes. So we started to improve and have a further distance. But anyone who understands geometry and they will understand that an angle and a distance is not sufficient to establish an angle. So we're still looking for the third discriminant, and at that point we will have good or bad responders. Then we are in the third decade with the TADS, with Canada, University of Alberta. What can we say about TADS? We can say that certainly using them at the end of the teenage years. So when I see TADs in 10-year-olds with the aim of just correcting transversal issues, I really don't agree with that, and the literature as well. We also have to learn to wonder what we want to do, because we want to transversally expand so we can have a born, or we just have want to have a nasal width, and so we can use TBMEs, because there are limited evidences. This is a recent article in so we have to be cautious about these procedures. Don't try to convince me 2 or 4 screws are more invasive than 0 screws. The last paper just published on EJO in 2021 says that after a large review of 8 papers, all in yellow or red zone, apart from the lids on one, which is green. Too bad that the case report is just on one patient. We know very well that the case report is really very limited. So as of today, until 20 years, my experience that I want to share with you is very simple. Up to 15 years of age, if you prefer to say CS6 or CS7 as a vertebral index, or you can use assisted expansions matched with corticopunctures, and also the SARPE, but SARPEs are not all the same. It depends on what we do with them altogether, because a beautiful work from Han in 2009 said that depending on what we cut, the reaction of alveolar processes changes. So if you want to be invasive, let's try to be invasive, but while maximizing the result, optimizing the result. Otherwise, we can just use two bands and a screw. As for corticopuncture therapy, they just work very well. The problem is that we still haven't understood how to make them work, because 1 out of 5 of them has side effects. So we still haven't understood how we should use them properly. In Milan, there is a research doctor, Dr. Cantarella, who's teaching us a lot about 3D designs, who is trying to make our RMEs. And when I start seeing RMEs with screws for mobile devices, or I have some doubts, because we can't use a normal expansion on an expansion like this at the level of TADS. And as a consequence, this is also something that was published on Progress in Orthodontics 5 years ago. There are different areas of distribution of the forces, because we also have problems, because normal screws tend to break, and we need dedicated screws. One day we will also talk about this, but we need bigger screws and bigger activation keys, and we need to understand where to put these mini screws, because that the distribution lines were wrong. We had known it for a long time, because we had large problems of asymmetry. So we had hybrids between Haas and Hyrax. But now I invite you to read the just published paper on the edition of June 2021 of the American Journal of Orthodontics, which explains that depending on where we place the screws, we have totally different corrections. In other words, the more the screw is in apical position, the more we have a movement that involves the root and not the crown. So in this way, we can optimize the use with the recent use of mini screws. Otherwise, we're just doing something that is in fashion, but we're not getting anything. And then we have the previous decade, the HITEB decade, where as a clinician I started using creativity, fantasy in my everyday practice. From a program chairman, I started to being director of this HITEB. We started to study things and started going beyond the orthodontic wires per se, and so we had new opportunities in diagnosis and treatment. As for diagnosis, the Italian school on aerodynamics is true both for external and internal structures. You just need to have a 3D FEM, a polyhedric mesh, and we can recreate super noses, and through them we can have the pressure go through, and also velocity go through, and indicate very precisely obstruction points. This allows us to change the flows. This is a pre-expansion flow, which is rough flow. This is epoch expansion RME, where we have upper and lower flow, but we are concerned by the upper flow. And this also allows us to understand that if we put a normal screw, we have to put it upwards and backwards, because often the nasal obstruction critical points are more backwards compared to our initial point of view. And we can also identify this through a 3D reconstruction. And then here's, what most of you are interested in, what I think about the different aligners in during the mixed edition, because this is one of the hot themes at the moment. Let's start. So basically we have very recent papers talking about tipping movements. The school of Professor Cozza in the conclusions talks about buccal tipping in the anterior, lateral and posterior regions. Maybe maybe Benedict Williams is right in his case report, who says first expand, then use aligners, which could be a good solution. But please don't think that you can expand with the current aligners. Maybe in the future it will be possible, but not now, because they're working on the material's thickness. We will see anyway. I understand that it is difficult to find something that is at the same time faster and cheaper. I would like to thank Valentina Lanteri, who's teaching me a lot of things on the combined use of elementary aligners. Such as elastic situations that don't need a replacement. So there's a simplification of the treatment. I'm growing old, so I want to have simple things. I leave it to young people to use 800 screws or aligners, etc. I want a peaceful life. But what I'm seeing from Valentina is very, very good and very simplified. So I could consider this in the future. And then let's get to the fifth decade, outside the wire. And we know very well that we have 4 megatrends: genetics, digital dentistry, pharmaceuticals, and alternative and complementary dentistry. There's a phrase from the father of all the interceptive orthodontics which fascinates me a lot. We know that dentition is a complex mechanism regulated by many factors, but basically, and this renders very much in English, much better in English. So are we talking about these harmonies, or are we talking about these harmonies? This is really a really interesting question, very fascinating one. And we know very well that the craniofacial morphology, this is kids with a very heavy class 2, because we have 73 of SN pogonion, and every day they have the same production of cortisol, and at night this changes very much. Cortisol is an IGF precursor, so it is fundamental, and it can be altered after RMEs. You see, before and after the RMEs, the production is changed. With a very simple RME, put it on the 6th or whatever you want, but do it, and soon. So with simple expanders, we can enter the system. It's not as easy as that, of course, but in the interest of time, I have to summarize. So let's get into this system, but before that, let's get into the precursors of this system. And this is why it is outside the wire. The precursors are fundamental for the production of gray matter. We will have a huge problem in the future. That is, our median age, life expectancy is increasing, so we have mental degeneration disorders, which will increase more and more. So starting from a lot of gray matter is fundamental in order to avoid Alzheimer issues or to delay them. So you will understand that we are talking about cortex and cognitive development. This is no crooked tooth. So when I see 2.5 years children, I want to try and start correcting the crossbite in order to obtain something very different. An infant bite trainer, for example, because I know very well that if I enter the system of those low wave sleep, this is the sleep phase where the growth hormone is secreted, where glial cells are the cells that restore our brain. We have an increase in the production of cortical synapses, and all of this allows us to start with a much higher reservoir of cells compared to what we had with crossbite. This is a very important statement, of course, and this is why you will see that Caprioglio et al. I don't know where I'm going to publish this. Probably it's going to take years to publish this, but I want to share with you what will be my next decade, because for the moment we only have 9 cases studied in this way. But I think that this red blot here is red stain is really beautiful. This is what I want to see, and I have to talk about it only with you, because you have to background and culture to understand it and to be cautious enough not to disseminate it. This is what these conferences are for, to lay the foundations for the future. And if this is our future, I partially agree with this English fan, and because also orthodontics is coming home, because it is returning in the domain of medicine as such. It is not just something limited to teeth, and as we know very well, it's not just orthodontics that is coming home. So we need, there's a Neapolitan newspaper, Il Mattino, that has a very important news on it today. We have a huge opportunity not to just work for teeth, but also for a development and also for prevention. I'm also especially talking to the young people. If you want to participate in these projects, you are more than welcome. So thank you once again to Sido and Idor for having me here, and thank you for your attention.